Hi everybody, this is Anubhav and we're going to take a look on part of heart. First thing we're going to look at layers of heart. There are major three layers you should be aware of. Let's go from inside to outside. The most innermost layer of heart is endocardium. Endo means inside and cardium refers to heart. This layer lining to the hollow chamber of heart is actually continues to all valves which we will talk about shortly. The next layer is myocardium, which is thickest layer. Myo as a prefix means muscle and cardium refers to heart. So this is cardiac muscle that contract the heart to generate force to pump the blood out. And the last layer is pericardium. Actually, the pericardial sac which covers the entire heart. Actually, there are two layers of pericardium. The one which is closest to heart, which is known as visceral pericardium, and the one which is at outer side is known as serous pericardium. So the visceral pericardium, the visceral means organ. The layer further away is known as serous pericardium. Alright, what pericardium to do is protect the heart by producing the fluid, serous fluid, and the simply lubricate the heart because as the muscle it contract and move, while doing this it generate force and friction, and we need to minimize this friction because it can cause injury, and that what pericardium sac does. The next thing I will look at are the various chamber of heart. So here it is very complex. So we can simply learn through by making a cartoon of heart. So let's make the cartoon of heart. Heart is of which color? Heart is of red color. So let's make the heart. So this is the heart. So it has basically divided into four parts. Okay, so the heart is divided into four chambers. Four chambers, the two at top. The two at top is known as arteria and the two at bottom is known as ventricles. So let's write it here. At top there are arteria and at the bottom part is known as ventricle. Okay, so the blood always enter arteria. So the blood always enter arteria. So let us use this blue color. The blood always enter arteria. So this is right arteria, left arteria, right ventricle and left ventricle. So the blood always enter the right arteria. The blood will flow from arteria to ventricle. Obviously, the blood will flow from arteria to right ventricle. It need to go through a space. There is space which has flap that open and closes. That open and closes. There are flaps here. Okay, that is what we call it as valve. So between right arteria and right ventricle there are flaps. There are basically flaps. So let's make the flaps with the purple color. So what are valves? The valves are one way and it has to be one way. Blood can come through this way, right artery to right ventricle. It is one way. The blood cannot go from ventricle to artery. So the blood, so valve, this valve is one way, and we don't want this blood to go up. So that's why it is one way. So this valve is known as tricuspid valve because there are three flaps. See, one, two, three. So this, because of this, it is known as tricuspid valve. So here is tricuspid valve between right atria and right ventricle. Tricuspid valve. The blood goes from right atria to right ventricle, and then the right ventricle is gonna pump out the blood. So one thing you have to remember, that artery always receive the blood and ventricle always pump out the blood. ठीक है, blood always leave ventricle. So that's the right hand side that we have studied. This is the right hand side we have studied. Now let's see the left hand side. So on the left hand side there are two valves. So we can write that there are two valves. So this valve is known as bicuspid or mitral valve. Bicuspid or mitral valve. There are two cusps. So because of that two cusp, we call it as bicuspid valve, or you can also say mitral valve. Bicuspid or mitral valve. ठीक है. So the blood flow from left atria to left ventricle through bicuspid or mitral valve. The blood flow into left ventricle will eject the blood. You can say that I have drawn two different colors. Okay, that's right, because the right side of heart deals with less oxygen, blood with less oxygen, and the left heart deal with blood with more oxygen. You have to think like this: the blood entering into heart has little oxygen, as oxygen must be coming back from the tissue of body because it has just delivered the oxygen. So this is coming from body. What does it want? It wants oxygen. So we need to deliver that blood to something to go back to the heart so that it generate more force, and when the heart contract it get oxygen from the lungs, so that it gets oxygen from the lungs. Where from it comes? It comes from body and goes into lungs. Once that the blood goes to the lung, blood pick oxygen from it, and then it go back to heart. Then it's go to the heart. From lungs it will go to the heart. Left artery. So this side is left side is dealing with more oxygen. So left side deal with more oxygen. Then from the left artery through the bicuspid or mitral valve, the oxygenated blood will go in the left ventricle, and from where it does go to the body to deliver oxygen, and then from the back from the body it will come from right atria through tricuspid valve, it will go to right ventricle. So this is the nice simple way to begin blood journey through the heart and through the various anatomical features. So we can translate it into more complex diagram. So we can say that this is right atrium, this is right ventricle, this is left atrium, and this is left ventricle. The blood come back from the body. The blood come back from the body not through one way, but through two way, that we call as vena cava. So there is inferior vena cava, inferior vena cava, and there is superior vena cava. Thus, and the blood is coming from superior vena cava and inferior vena cava, and the blood is coming into the back from the body into right arteria. It goes through tricuspid valve. Here is tricuspid valve, which you can see, and into the right ventricle. And when the heart contract, the blood will get ejected out. When heart contract, the blood will ejected out, and we know it will go into lungs. Okay, the deoxygenated blood will go into lungs, and we got two lungs. So therefore, obviously the blood vessel need to split into two. The one will go into right lung, and the one will go to left lung. So before it, there is also a valve here which is known as semilunar valve or pulmonary valve. So here is semilunar valve or pulmonary valve. Semilunar valve, or better to say pulmonary semilunar valve. The pulmonary referring to the lungs, and then it goes into trunk. So this is basically trunk. This is pulmonary trunk because it look like trunk, and then further it has two branches, right and left pulmonary arteries. Important point here, artery always leave the heart. What arteries always leave the heart? Artery always leave the heart, and veins always return. So once it go to lungs, it get that oxygen, and it need to go to left artery. It will come into left artery so that it can go back to the heart. So there are two pulmonary veins. There are pulmonary veins. From pulmonary veins, that oxygenated blood from the lungs will get into left arteria through bicuspid valve into left ventricle, and left ventricle will contract and eject the blood out of through a artery known as aorta. But again, here is semilunar valve. So in aorta there is also a valve known as semilunar valve. Better to say aortic semilunar valve. Better to say what? Aortic semilunar valve. When it's moved through here, it is known as aortic arch. So this is aortic arch, which then delivers the oxygenated blood down to body. I hope your basic concept regarding to anatomy of heart is cleared. If you like this video, make sure to subscribe and share to your friends. Bye bye. Take care.